This is the Nuance Podcast by Medicine Explained. We're your hosts, Amanda
and Dan.
We talk to experts on health, the human experience, and the intersection of climate and human health.
We explore the nuance that's been lost in today's conversation. We don't take ads because we want to keep our information unbiased.
But we do need your support. So leave a review on Apple or Spotify.
And share with your friends or on social media.
In today's conversation, we had the opportunity to speak with Dr. Kinari Webb, MD, who graduated from Yale University's School of Medicine with honors and completed her residency in family medicine at Contra Costa Regional Medical Center in Martinez, California. She then founded Health in Harmony, an international nonprofit dedicated to reversing global heating, understanding that rainforests are essential for the survival of humanity. Based on information gleaned from a year spent traveling around Indonesia, Health in Harmony's project, ASRI, was sited in Sukadana on the border of Gunung Palung in 2007. The key focus of the work has always been radically listening to communities and responding to the needs they identify. She speaks regularly on topics ranging from the health and future of the forests, community involvement and social capital, healthcare in the global south, and the link between human and environmental health. She's the author of the inspiring book, Guardians of the Trees, A Journey of Hope Through Healing the Planet, a memoir. We really enjoyed this conversation, and we hope you do too. Now, onto the podcast. Hi, Dr. Webb. Welcome to the podcast. I'm so unbelievably excited to talk to you. I loved your book, Guardians of the Trees, A Journey of Hope Through Healing the Planet. And I have just been so inspired by your story, your journey, and all the work you've done. So we do have a recording that I did of your intro, but I would love for you to just introduce yourself to our audience in your own words.
Oh, thank you. It's such an honor to be here. I always feel like, who am I? Not really anyone. Let's just say that first off.
But a lot of things all in one.
Yeah, but really, I think the joy in my life has been to get to follow others and to get to go along a path that rainforest communities showed me, and then to get to go with many, many other people. And that's been a joy in my life, to get to think about how we flip the script. And the script has been that those in the global north know the way, that they know what they're talking about, and that's just wrong. And if we're going to heal our planet, if we really think about our planet as a living being, and we think about the heart and lungs of the earth being the rainforests of the world, we have to think very differently. We have to understand that we're all in this together, and those who are the guardians of that forest are really some of the most important people on the planet. And we need to listen to them, and we need to follow them. Yeah,
beautifully
that's
said.
Me.
Thank you. Thank you for sharing that. And I highly recommend your book. But for those of us who haven't read your story, you started off with some interesting stories studying in the rainforests of Borneo. So how did you start there and then decide to go to medical school?
Yeah, so I actually went to Borneo as an undergraduate to study orangutans. I came up with this crazy idea that I wanted to do this, and that I wanted to maybe, pursue a career in primatology and, follow in Jane Goodall's footsteps. But then when I got there and I was spending all this time alone in the forest, and so beautiful, amazingly beautiful, but the forest was disappearing around me. And you could just hear these giant 22-story tall trees. I mean, some of the biggest trees in the world crashing to the ground. And it just like broke my heart. And I thought, what is wrong with these terrible, evil loggers? How could they do this? And then I got to know many of those men. And over time, I found out that many of them were logging just to pay for healthcare. And that truth and this understanding that human health and environmental health are inseparable, in both directions. So if the forest is destroyed, human health is destroyed. And if human health is insufficient, people will do whatever it takes to try and get their future. This year I had a C-section, and which was a wonderful joy, but it was also very expensive despite the fact that I had health insurance. And my family would have done whatever it took to get that care for me, and I would have been grateful for it. Mm-hmm. And there you are in Indonesia, and the same challenges are being faced by communities. But when you're a subsistence agriculturalist, which is to say you're growing enough food to eat and to make plans and to be able to, put away money for planned expenses, but one medical emergency can cost an entire year's income. And how do you get fast cash, or how do you pay back the money you have to borrow in order to get that money? Often the only way is to destroy your future by logging. And they really get that that's what's happening. And I just thought, we can't be in a situation where this is what happens in the world. That's just, we won't make it if people are in these horrible catch-22s. And so I realized as well that just how blessed I had been. Nothing that I did. I was born in the richest country in the world. I had very educated parents. I lived in a small community in northern New Mexico. My parents were hippies. But I had opportunities. Someone would give me the money to go to medical school. Mm-hmm. And, the government would probably give it to me. And indeed, that's what happened. I was able to borrow money and was able to get in. And many of the women that I knew in these small communities in Borneo, that never would have been an option. Never. And here you are, Amanda, you've gone to medical school. And that's a beautiful gift that you can offer to the world in many, many ways.
Yeah. Wow. Thank you for sharing. There's so many aspects to your story and what you just said that I want to jump into. But I think the first thing that I'd like to expand on is what your clinic and business model then looked like, because you saw this problem with medical expenses and how the local community was paying for these medical expenses through logging. But like you said, we can't blame them because they were just trying to pay for their health. So how did you set up your clinic to help address these issues?
Yeah, so communities fully 100% got this, right? That they wanted a positive future. They just didn't know how to get it. And part of the reason they had so few resources because of a long history of colonialism. So from my perspective, resources needed to flow back to these communities in reciprocity. Gifts. These communities were giving an incredible gift to the world of protecting forest, or potentially being able to protect forest. And the world could give them thanks in return. So we asked communities everywhere around the national park, what would you need as a thanks from the world? And so that you can thrive and the forest can thrive. And they said, we need healthcare access and we need organic farming training. And then what we did is we tied them really closely together. So, which is to say, the thanks were greater when the forest was more protected. So people could get up to a 70% discount in the cost of care, which was already very cheap. A normal doctor visit would cost about a bowl of soup, so it wasn't very expensive, but you got a 70% discount if your whole community was protecting the forest. So this kind of got people to work together as a community. And as they described it when they were designing the system, this helps us get the few cheaters to stop. Mm. But then we also wanted everyone to be able to afford care, no matter how poor. And especially for expensive visits, where you would stay, might stay in the hospital, and then that would take more money. So we allowed people to pay with non-cash payment options. They could pay with seedlings. They could pay with beautiful handicrafts from the forest. They could pay with manure that, brought a lot of chuckles. You mean we can pay with poop for medicine? So, yep, you can, which we would then use in the organic farming training. And labor. You could also pay with labor. And that, it was a way of doing it with justice, and at the same time, really providing, access to care, but also an encouragement, a greater thank you. Mm-hmm. And it worked. So, and then we also worked on alternative livelihoods like they designed. 10 years later, 90% drop in logging households, 70% drop in the loss of forest. It was the amount of forest, the primary forest that was saved was equivalent to about $65 million worth of carbon compared to other national parks. And then that didn't even count 52,000 acres of rainforest that grew back. And at the same time, infant mortality dropped 67%. So, and that, health was improving across Indonesia. But what this tells me as well is that you can totally stop logging and still really improve your health. Mm-hmm. And people were also doing very well economically. So that's, it's very encouraging to me. One man said, one of the leaders of one of the communities has said, we are the pathfinders for where the world needs to go for how to live in balance with the earth. And that's what I meant in the beginning when I said, I'm following their path.
Wow. Congratulations on your success and the community's success. That's really amazing. And something that really stands out in your story is the ability of the community to know how to live in balance with nature, which I feel like we've lost. So the knowledge and the intuition of how to protect Mother Earth seems to not follow GDP trends. So the communities that may look like they are developing nations or have the lowest GDP are actually the ones who do know how to live in harmony with nature. So I think that kind of leads to the question of why is it important to give attention to and resources to developing countries when addressing climate change?
Yeah, well, GDP is a perfect example of the serious problems with our economic system in this country, in this world, right? Mm-hmm. That we are measuring completely the wrong things, right? We are measuring destruction. Mm-hmm. If you pay more money on healthcare, that actually increases your GDP, but the world, your group of people are doing worse, mm-hmm. right? You extracting minerals to the point that you have no minerals left raises your GDP. Pumping CO2 into the atmosphere to the point where we're going to kill us all off raises your GDP, right? This is a serious, serious, serious problem in the way that we are measuring things. And, an indigenous method of, well, there's many different indigenous methods, right? But there is a trend across, if you look at most of the economic systems in indigenous communities, they tend to be based on reciprocity, mutual gift giving. And if you, and looking at what's beautiful about that system is you can really think about the wholeness of value of something. For example, I'm very opposed to even though I gave you the carbon numbers, I'm still very opposed to measuring the carbon of forests exclusively and seeing them only in that way. Because they're also about pumping rain all over the planet. They are about beauty. They have half of the world's ecosystems. They're about sacred value, for communities. There are so many different values. And if we can see that value in its wholeness, we can understand the greater gifts that we are giving to each other. And these communities are giving a gift to the entire planet and should receive gifts in return, especially since they've had resources stolen from them for so long. So it is well in time that we begin to look differently at our economic system. And I think what really scares people is this idea of loss. They're so scared of losing that they can't see that what they could gain is greater than what they would lose.
So you made this very successful clinic in Indonesia, and now Health and Harmony is doing amazing work across the globe. Like, I think there's a couple in Brazil, and where else are you?
Yeah, so we're in Madagascar.
Okay.
So our thinking after we were so successful in one site was, well, okay, is this going to work anywhere else? Right? We don't know. So one of the things that had amazed me so much about this process that we call radical listening is that all the communities in that region came to the same conclusion about what the solutions were. Well, would that be same in a different ecosystem? Right? Well, would they come to the same conclusions? Unlikely, but would they come to similar conclusions to each other? Would that area all agree on what the solutions were? That was one question. The other question was, well, if we met those solutions, would it transform things as dramatically as it did in the first site? And not just in Indonesia, but also in other very different cultures. Because if this is going to work, then it needs to work everywhere, right? So, sure enough, radical listening, everywhere we've done it in the world, and we've done it many, many places, either ourselves or with other folks that we've taught, a given ecosystem, they all come to the same conclusions. They tend to have things in kind of big buckets. One tends to be around health, one tends to be around economic well-being, one tends to be around education. Although most of the places we've worked also have tenure, which is to say that those communities have some rights over the land, but in places that they don't, that's also a very big issue. So, so we're trying, and it's working incredibly well. And I have to say, it's not fast enough. It takes a long time for us to do this work, and we don't have much time left on this planet. If we continue the loss of forest at the rate that we're losing it, it won't be pretty. There are these tipping points that happen where if you lose too much forest, then the forest isn't creating enough rain to feed the rest of the forest. If we go over that tipping point in the Amazon, it's probably game over for civilization. So it's urgent. It's so urgent that we feel like we have to move faster than we would prefer. We would prefer just to get great data for the next 10 years and then scale. But actually, we have to scale now. So we're working on a new app. It's called the Rainforest Exchange. And it's a means by which rainforest communities' solutions can be uploaded. You can see them, and you can transparently see the outcomes as well. We're working on ways that you'll be able to connect with communities and really realize how intertwined all our livelihoods and all our well-beings are. So
that's amazing. That's amazing. And that was one of my questions too, is this is such a successful model, but the issue with like things coming out of Silicon Valley is everyone's like, scalable. How do we scale this? But we do need to scale the model that you've created. And it's just so interesting to me. I'm currently reading Collapse by Jared Diamond, which
I love that book.
Yes. And it's a little difficult to listen to in the state that we're in, because I'm like, a lot of these signals and red flags that happened in civilizations that have collapsed seem to be raised in the society we're living in now. And it's not just like the US or whatever, it's global now. I mean, everything is global. And this an interesting study, which is kind of something that I've been trying to like grapple in my mind, is like, why is everyone in so much denial that this is such an existential issue? And they did a study on people who lived closest to the dams. And so if you live closest to the dam, like right underneath it, people were not worried about the dam breaking. They're like, oh, it's fine. There was like psychological denial. And the further you moved away from the dam, people got more and more nervous about the dam breaking. So the imminent threat actually makes humans not even want to like come to realization of what's happening. What can we do about this, Dr. Webb?
I'll just point out that the thing that I loved about Collapse was this understanding that you collapse at peak and you just go straight down. There isn't this nice slow decline. And I think that that's what most people think will happen. a slow, gradual decline. But collapse could very well just be a sheer cliff. And I don't know, it's funny. I was listening yesterday to a thing about loving yourself, meditations about loving yourself. And one of the things it says, the more you push something away, the more you can't heal it, right? So like if we can't face like loving yourself, which is such a fundamental core basic part, right? You're just turning away, and then it actually makes it worse. You actually love yourself less. And I feel like that's the way it is with climate change. The fact that we can't face it actually makes it worse. And it builds it more and more. But yet if we turn to it it's very similar. It's very similar. It's about loving our earth, loving ourselves actually as well, because we are inseparable from the earth. And in my book, I started off wanting to just write about the work, but I found I couldn't do that because I discovered that the healing of self can't be taken away from the healing of our planet. So I had to write about both. I had to write about my own struggles. I had to write about my struggles with colonialism, that inherent yuckiness in all of us, right? I had to write about my own struggles with personal trauma, intergenerational trauma, because we can't heal if we can't love ourselves. We can't be our fullness in what we can give to the world. And when we give our fullness, that is beautiful. And that's what I saw in the communities around Gunung Palung National Park. This sense of like, look at what we did. Give us the next problem. Like, this is so exciting. People telling me 15 years later, like, boy, when I designed this program, I did such a great job.
That's amazing.
Yeah.
That's so beautiful. That's amazing. I very much agree with that. I think that's a really good point. And something very interesting, I was talking to Dr. Yuria Solidwin, who is a indigenous scholar, on Friday, and she just wrote a paper about indigenous healing of the world and the planet with some co-authors, and included elders and other indigenous folks. And what she said is that we've always had such a human-centric view in Western society of the world, whether that be we are the problem, which is human-centric, or we are the solution, human-centric, but we're all connected. Like you were saying, like healing yourself is healing the planet, and you can't write your story or tell your story without intertwining both, because it isn't about only us, but we do have to see ourselves as part of nature.
Yeah. And there's this, like Braiding Sweetgrass. I don't know if you've read that book. One of my favorite books. Robin Wall Kimmerer. She talks about this sense that actually humans are essential for healthy nature, right? Like we really know that in California. Like humans have been beautifully tending these landscapes for thousands of years. And when we, as Western colonist, settler arrivals, thought, no, this is nature. We have to like leave it alone. We have to like not, let it do its own thing. That's kind of wrong, actually. And it's causing enormous, horrible wildfires. Of course, it's also interconnected. Those fires are also because of the loss of rainforest in the Amazon and even in the Congo Basin and even in Indonesia, which leads to less rainfall in the Northern Hemisphere. So it's all interconnected, and we need to. Yeah, a friend of mine put it this way. She said, humans are Keystone Species. Like we're actually essential for the earth. Robin Wall Kimmerer talks about what would it mean if you thought that not just you loved the earth, but the earth loved you. Right? That's like completely just most Western culture, exactly as you said. Humans are the problem. We are a virus. We are a, cancer. We need to be killed. No, we are also the solution.
Yeah. And for those of us listening who don't exactly know what a keystone species is, it was like the example of Yellowstone and the wolf reintroduction, or the wolf loss and then reintroduction. So wolves were the keystone species in Yellowstone, and all the farmers and all the conservationists thought that they were killing too many elk and killing too many of the farmers' wildlife, or farmers like cattle and such. So they removed all the wolves, but then it completely disrupted the ecosystem of Yellowstone. There were too many elk, which were eating all the grass, and then nothing else could survive. The trees weren't growing. So that's what I think Dr. Webb means about a keystone species. Like if we're taken away, it'll all be out of balance too.
That's right. Or in the rainforest, the fig species are the keystone species in Southeast Asia.
Really?
Because they fruit all the time. So, and then most of the other trees only fruit every 4 years. And so all the animals can feed on fruit, on the figs, when their other trees are not fruiting. So if you take away the figs, all the ecosystem would collapse.
Wow.
But with the figs, the ecosystem does really well. We can be that beautiful keystone species.
Yeah. Something that you've mentioned a couple of times too is radical listening, which I think is so beautiful. I'm concurrently getting my MPH with my MD, which is the Master's in Public Health, and I want to continue to do public health work because, like you were saying, we need to scale things. So I want to help people at the individual level, but also scale. I think that it's so important to listen to communities. A lot of times we can be paternalistic in deciding what is best for a community, especially in developing nations or just minority populations or lower socioeconomic communities in the United States. So can you explain to us what radical listening means and how we can practice it in our own lives, and why it's so important for not just people like doctors doing it or public health professionals, but why is it so important for everyone to practice radical listening?
Yeah. So first of all, why do we even call it radical listening? And how is it different from just listening? Right. Well, the main thing is I call it radical because we actually do what people say. It's not about listening to one individual only. It's about listening to the collective wisdom of a group, putting people, having people sit in a big circle and then just listening, like posing a very open-ended question about what the healing solutions are, and then just trusting that the communities know that. And it's very interesting to me too, because even organizations like Doctors Without Borders, which, they are starting to recognize that their method of outsiders coming in and saying, we know the solutions, we know how to deal with the crisis, here we go, it doesn't always work that well. Mm-hmm. And in fact, they need to be able to listen to communities, understand what the sort of broader solutions are, and address them holistically. That's the thing that we find, is that when we ask communities what the solutions are, they always come to intersectional solutions, which is to say, all these pieces fit together. They don't think in silos. And why? Because the world is not in silos. There isn't this thing of like healthcare over here, economics right here, conservation over here, like
heart, kidney, GI
right.
system.
Exactly. Oh my God, yes. Amanda, you get me. And you will be amazed as a family medicine doc how often you're like, these specialists are not even thinking about the other parts of the body, but guess what? They're all in one person. It's this reductionist approach, right? Which has admittedly yielded some great benefits, right? Like when that approach, we figured out how to treat tuberculosis. That's great. Yay, right? We figured out antibiotics. So it's not that that's all bad, but it is problematic if you think that's the only way things are, because they're not. They're all interconnected. And so communities come to these solutions that put all these pieces together. And I believe that one of the major reasons that we've been so successful is that the answers, that we're fulfilling all those parts of the solutions in one go. So I'll tell you a story of a man who fell that's in the book, that a man who fell from the top of a coconut palm and broke his back and smashed up his foot and got a really bad infection in his bone in his foot. And it took him years before he, as he said, forced himself to learn to walk again. But then his life was very, very marginal. And he came to our first organic farm training and then to our second one. And at the second one, he almost passed out. I caught him. He had this horrible, horrible fever. It turned out he was very, very sick. He had a blood infection from the infection in his bone. So we were able to cure him. Well, it was going to take a while, but on the second day in the hospital, after he was feeling much better, he said, I gotta go back to the training. I was like, no. You are very sick. You're going to stay in the clinic. Don't worry about it. He's like, no, you do not understand. Right. I doubled my yield. I was able to get, I can make my own fertilizer now with compost that I had no idea how to do that. And I was having to spend enormous amounts of money to get fertilizer. And I can even now send my children to school. There is no way you are keeping me away from that training. Right. So that really taught me, it's like, okay, if we had just done the organic farming training, that would have helped him. But without being able to cure him physically, that also wasn't, he was going to die soon. There was no way he was going to live long with that horrible infection in his bones. And then just doing the healthcare would have helped him, but not as much. But also protecting the rainforest meant that his crops had more water, meant that he was healthier. There was less risk of malaria, all of those things together. So all the pieces spiral into a positive effect for the whole community. Yeah.
That's so amazing. I'm so glad that I came across your book, because the way that you think is just so inspiring. And I'm actually working on a food policy campaign to increase regenerative organic agriculture.
Yes.
And it's everything is so interconnected, and you're touching upon all of this stuff. And I'm like, oh my gosh, this is amazing. Yeah. This is what I've been thinking. And it's so unique in the healthcare setting, specifically for physicians. So I just can't believe that you came across this thinking, the intersection of human and planetary health, when it really wasn't. It was a novel idea, because there are people.
It wasn't me, right?
Yeah.
One thing I know how to do is listen. That's it.
It's the most important thing that a physician can do. Okay. And so we were talking a little bit about radical listening, and you had mentioned organic farming. I get very excited by the idea of farming sustainably, because obviously we need to grow food to survive, but how do we do it sustainably? Mm-hmm. I think there's this connection that we can easily make. There's still a little bit of a disconnect, that environmental toxins can harm human health. So pollution and CO2 and all of that, we can see it's polluting our air, and so we can't breathe, which is important for survival. Or our drinking water is contaminated from industry, which is also harmful to our health. But something really important, which we don't talk about as much, is rainforests. And I know you've touched upon the importance of it a little bit, but can you give us specifics as to why protecting the rainforest is so important for human health, and not just saving their orangutans or biodiversity, which is also very important?
Yeah. So there's this idea that's, sort of a shorthand of talking about the rainforest as the heart and the lungs of the earth. And the reason for that, the reason they call it the heart, is because the rainforests of the planet create these huge rivers in the air, in the atmosphere, that basically bring water halfway around the world. And I just was talking to a friend yesterday who was writing a paper for college about why it is that this story has been buried. Why is it not in all of the press? And it's a very interesting question of why that's the case. But the scientific literature is very, very clear that droughts in the Northern Hemisphere are partly from the loss of rainforest in the tropics. So that is super important. That's just we can feel that in a day-to-day basis, right? Especially I live in California. It's very serious, the drought here. But it's not just that. The rainforests of the world have half the world's biodiversity. And we're in a massive biodiversity crisis as well, where we are losing all of this biodiversity. And the biodiversity is important because, first of all, there's just like, it's miraculous, all the things that have been created through evolution, right? So, and a lot of those are useful for medicines or useful for, inventing new things. But also more diverse ecosystems are more resilient, which means that they can handle changes in temperature or changes in, climate better. So that's really important. And then the other thing about them is they store enormous amounts of carbon, right? So even what a lot of people don't realize, that even if we stopped all fossil fuel emissions today, like 100%, which would be very difficult to do, but let's say we did that, and we continued the loss of rainforest at its current pace, so much carbon would be released that climate change would just be runaway, right? So the current rate of deforestation releases as much as the entire transportation sector for the entire world, right? So it's huge. But even more important, when these forests are standing, they're sucking down the CO2 that we release from the atmosphere. So a third of the pollution that humans emit every year is actually brought down out of the atmosphere by trees, by the forests. So they are an enormous part of the solution. And if we lose them, they're an enormous part of the problem. So they're our best friends. The forests are just like essential. And then I also, am spiritual enough to understand their spiritual value in the world. Anyone who's ever been in the rainforests of the world can see that they are sacred.
Yeah. And I mean, you did a great job explaining why the forests are so important. But if we're in the US, your clinic is like a beautiful model and is working so successfully. And you said that there's some families who have been saving up and they do farming and can save up for like what they need to buy. But when a medical expense happens and they're bankrupt, happens in the US too.
Sure does.
So is there any way that communities in the United States can use a similar business structure to your clinic and protecting the environment, doing gift giving and reciprocity and using those systems? I was thinking about it the other day, and I grew up in a town of 1,200 people in a rural farming community. And I think that the way that your clinic runs could work very well there because we are able to like produce our own food and we have things that we can exchange. But in cities is a little harder because we outsource and import everything. So have you thought about trying to implement something like this into the US?
So I teach a radical listening class, a webinar once a month, and you can check it out at radicallistening.org if you ever want to join us, or if any of your listeners do. But one of the things that we do is actually do a practice radical listening session. And I ask the question, what would you need as a thank you from the world community so that you could protect the forest? Not protect the forest, so that you could reduce your carbon emissions, right? Because I'm asking a question that would work for people joining from all over the world. And we all have carbon emissions, right? But what's so fascinating to me that what's come out of that is a number of different times people have come up with a very creative solution collectively. And that solution is, what if we all got benefits from the government, like points that we could spend on education or on healthcare or on things that would make the world better, right? And in relation to how much carbon we were emitting. So the less carbon we were emitting, or maybe even if it was on a community-wide basis, the less carbon your community is emitting, the more points you would get. And these are things the government's already paying for, right? And the government wants to think about the health of the future. We hope they do. And they also want, economics to do well, people to thrive. So this would be, and we're already paying for things like Medicare and, scholarships for education. But if it were tied to carbon emissions, and of course, most people who have been historically marginalized have a lot less carbon emissions, but it would be an encouragement for everyone to reduce their emissions. So that's a thought that I didn't come up with, but was come up with in one of these radical listening, or a number of these radical listening sessions. I don't know how to do this, right? But I bet if we all met together and we tried to figure it out, we could come up with some great solutions.
Yeah. Wow. I love that idea. The one thing that I think of with that too is how would marginalized and like lower income people deal with that? Because a lot of times there isn't a choice and they have to buy the cheapest plastic. They have to drive to work, and maybe their car is like gas guzzling because it was the cheapest one that they could afford, which again leads to GDP. Where is the equality?
Yeah.
Like we need to like subsidize people a little bit so that it's not putting out fires on a daily basis that you can't even think about. Like, do I want to protect this earth? Because that's just an unfair choice to put into people's hands sometimes.
That's right. And the truth of the matter is the price should reflect the actual cost to the earth, right? Mm-hmm. So organic, beautifully grown, local food should cost way less than food imported from China that's, that uses soybeans from Brazil and, wrapped in plastic. This is, yes, it should cost much more because it actually is much more expensive.
Yeah. Yeah. I like that, the reflecting the prices, especially with working with regenerative organic agriculture. It's so expensive to get that kind of food, but it's because it's not subsidized by the government, like corn and soy and all of that is, but that's just absolutely destructive. Yeah. So that's, I love the radical listening idea. I think that's beautiful. And so I know that you touched a little bit upon this in the last question, but for those of us who aren't necessarily going to start our own clinic in Indonesia or Madagascar, what are things that we can do in our everyday lives that can help protect the environment, maybe even protect forests or just reduce carbon emissions?
So anyone who wants to give a gift of gratitude to rainforest communities and wants to do so through the Rainforest Exchange, we're incredibly grateful to that. But really, I'm not going to tell each person what their piece of the puzzle is. I know that each person, if you look deep in your soul, that if you love yourself enough, if you follow your passion enough, I really believe that each of us has some small piece of this puzzle, and that all together we can transform it and we can work towards thriving where we're all doing better now, better in the future than we are doing now, right? Like there is huge cost to our life right now. And there are costs on our soul as well. I recently moved from a destructive Bank of America, which is, giving money to fossil fuel companies and giving money to rainforest destruction, et cetera. And I moved to a small community bank. And it was a hassle, I got to tell you. To change all your automatic payments and all that kind of stuff, right? Yeah. But boy, I had no idea that I would have so much energy from it. Mm-hmm. That every time I pulled out my credit card, I would feel my little green America credit card. And I would feel like, yeah, I feel good about using this, I really was surprised that it would free up energy in my life. Yeah. That I was draining energy in a way I didn't even realize. Mm-hmm. Every single time I use something with plastic, it breaks my heart. That it is not actually beneficial to us.
So I have one final question for you today. And it's first of all, would you like to leave our listeners with one final thought about health, about the planet, about the intersection between planetary and human health? I know that you were saying that it was such a drain just to use the which one were you using? Bank of America? Yeah. And
Chase is even worse.
Yeah, there's bad ones. But I know that there's a lot of like climate anxiety going on around us. And like we said, it's like this imminent threat can be really hard to deal with. And I know in the last IPCC report, there was a specific chapter on like climate anxiety and mental health related to the environment. So what advice can you give us as we move through these scary times that is motivating even through like all of the destruction?
It's really scary. We are truly facing the cliff. We are. I start my book in this description of being on a horse when I was a young girl, and the horse bolted for the edge of the mesa and I almost went over the edge. And I remembered the last second that a horse can't run with something hanging from its neck. And I swung myself full gallop underneath the horse and hung out on both sides. And we slid to a stop right before the edge. And that's what it feels like to me. Often it really does. It feels like, okay, it's true. We're headed straight for the edge of the mesa. And we won't make it if we go over the edge. None of us will. And yet, runaway horses are stopped.
Mm-hmm.
And I think there's key pieces of it. One is loving yourself, healing the intergenerational trauma, listening to those who are closest to a problem and trusting those solutions. And then understanding that everything is interrelated. If any of us are suffering, we're all suffering. And if any of the parts of this glorious earth are suffering, we're all suffering. And the flip of that is we can all thrive together. Can we do it? I don't know, but I'm going to give everything I got.
That's so beautiful. Thank you. And I think when you were talking about like biodiversity and stuff too, there's so many things that we don't even know exists out in nature that we need to protect. Like, I think we're talking more and more about biodiversity and it being important in like farming and bringing like regenerative organic farming, bring back species of insects and such. And the biodiversity of the forest is so amazing. And we don't even know like a minuscule amount of what that could mean for us. And I think it's just like one of the first steps for like Western society is to just realize how much we are connected and we can't just be dominant over nature. But I love your analogy with a runaway horse. And that was a wild story. Quick thinking.
Yeah, it did teach me, don't give up.
Yeah. A little bit of a tough way to learn that, but I'm glad that everyone's okay. Okay, so lastly, we do ask all of our guests to finish the following sentence. The future is blank.
Possible.
Amazing.
Yeah, the future can be beautiful. We can get there, but we have to do it together.
I love that. And I completely agree. And every time I speak to someone like you, Dr. Webb, even though all of the news is kind of doom and gloom, there are so many people working on this issue. And like you said, if we have radical listening and if we all come together with a solution, anything's possible. So I really, really appreciate you spending time with me today. I was just so inspired by your book. I actually sent it immediately to my mom, and she's currently reading it now. And she's like, "Tell me how the interview goes. I'm so excited." She seems so cool. Yeah. So I mean, happy that we connected, and hopefully we can stay in touch.
Thank you. And good luck with your fabulous journey. I can't wait to hear how it goes.
Thank you. Thank you so much.